I'm going to be like hyper specific because we find that the best impact is created through contextualized solutions. So, for example, when I was in Ethiopia, as I mentioned, we work in the sanitation space, and one of the things that is helping to bring down the cost of sanitation is a insert product for a latrine pit called the Sauto pan, which IDE helped to develop in Bangladesh with Lixil and American Standard. Well, when you import that into Ethiopia, it's actually taxed as a luxury good. So how do you short circuit the recommendation between specific products that bring livelihood change and get that information into the right ministries at the government level to eliminate tariffs? Another example from my past work when I was in Nigeria was really high import taxes on fertilizer. Well, if you're looking at a country at that time, which was importing half of its rice for the population, 3 billion tons, they were taxing fertilizer again at a much higher rate. So it's a disincentive for farmers to be able to use the right amounts of fertilizer. They would use smaller amounts, which means you have lower food production. So really looking at policy changes that can help to improve social impact. And then I would say in the finance area, which is something we've talked about extensively today, is really right sizing financial products. So how do you minimize collateral requirements, which are a specific disadvantage to women? Often in many of the developing countries, you have to have 3 times the amount of funds in your account for the amount you want to borrow. Well, if you don't have money in the first place, how are you supposed to have 3 times the amount of money to be able to do that? And the second thing is we know that there's a lot of informal economic activity going on. How do we use AI? How do we use digital tools to be able to track those transactions and use that as the credit history for women who are starting in the informal sector, and then use that as a ladder to get into the formal sector?
Mm-hmm. Thanks. Jennifer, do you have anything to add?
Sure. So especially as we gear up our approaches and focusing on equity, so ensuring that we're working with as many women entrepreneurs as men, for example. More in-country policies to support women, particularly in the reduction of gender-based violence. So there's lots of research out there, and lots of organizations have talked about how when women are economically empowered, often gender-based violence or instances of femicide increase. So ensuring that countries have strong systems to reduce the rates of gender-based violence. Oftentimes the folks we talk to, they may disclose this information to us, and the people that we refer them to, which is the process in that community, they don't feel safe reporting that. So how do we set people up for success? And also working a lot with organizations that are working on the ground to know when policy is realistic. So on the cultural norm side, for example, I was recently visiting our Ghana team, and we were speaking to one of their partners who works especially with widows and orphans, talking about a lot of the harmful cultural practices that happen particularly to women widows. That also impede their ability to carry out livelihood activities. So they're unable to work during mourning periods, for example, and ensuring that although there are laws there, they're not enforced. So working with local organizations on the ground that know the true situation. Also being careful to not apply research from other countries to that particular country to create policy, but really investing in research in that country to create new policy. For example, we do a lot of research on sanitation subsidies and what is the right amount and the right time to offer them when you're trying to get full sanitation coverage. And in one country we worked in, they had a very high amount of coverage required before you could offer sanitation subsidies, but that just didn't make sense for the economic situation of those communities. So luckily we were able to work with the Ministry of Health in that country. But yeah, always ensuring that we're applying contextually appropriate research as well to make decisions.